Guys, so hip bursitis, I would be thinking that that's an overloading of the lateral hip, which is making the bursa a bit irritable. So as always, I'll be wanting to ask myself, okay, well, what's not doing its job? It's maybe putting extra load through there. So again, maybe that person has a Trendelenburg kind of gait, but again, what's not doing its job? So do they have a lack of intent through the big toe that's maybe causing or contributing to that? Are they not using the medial hamstring gastro? Can they not elevate the rib cage on the same side? So again, there's a whole host of things that we'd be looking for, maybe not doing its job, that's causing that area to overload, or obviously the chicken and the egg. So I would settle the symptoms, using hands-on, working around the area, getting all those tissues to settle down, your traditional stuff, and then get to work on getting the other parts of the body maybe not doing its job. But a lot of that would come in the assessment. I'll be honest, I don't pay a whole lot of attention to kind of static posture, if I'm being honest. But if you thought that this was due to maybe a lack of intent through the little toe, have they broke the little toe? Have they got a history of shin splints that maybe when they push through their little toe that they're going to stimulate the tib post, and they're afraid to load that? So again, that for me would depend on the injury history and why they're not tolerating load through certain tissues. But I'll be honest, I don't pay, as I said, a whole lot of attention to that stuff. I'm more interested in how they're functioning dynamically, and I think sometimes when you got that intricate, I tend to get a little bit lost. So I just keep it very, very simple. Get intent, but with somebody like that, when we're doing a lot of our exercises, I'm very interested if they've got good intent through the little toe on that scenario, or they may be just overloading through the big toe. Okay, so again, working my way up through the chain to maybe desensitize some tissues like tib post, or again, it could be that medial gastro, or it could be medial hamstrings, or something further up the chain there as well. Yeah, this is, again, it's so hard. Like generally, it's not a cop-out, but how I work is I literally have to know the injury history, and I have to know what's happening in the assessment before I can piece the puzzle together. So you'll definitely get some joy in probably getting the rib cage moving, getting the hamstring to tolerate a little bit more load, which may influence pelvis position and all this stuff. But from my experience, to get rid of this and to make sure it stays away, you're doing high speeds and high loads that you really need to be specific to the patient. So I apologize, it's not a cop-out, this is just the way I work. That I have to know the injury history, I have to know what's happening in the objective assessment, and then I piece the puzzle together through that, rather than giving generic kind of exercises, because I just think that's, you're just throwing stuff at the wall and hoping something sticks. It's just I work the complete opposite like that. I'm very much treat, retest, and always correlated to the person's story. So sorry about that. Yeah, this is a really good question. I think for me, a lot of it, it's about quality. So again, a lot of what we do is kind of coordinated focus. So when I start to see the athlete fatiguing, I may be using strategies that aren't particularly useful for them. That's then usually when I might give them a break, or I might just get them to stop altogether. But I think for me, first and foremost, with a lot of our exercises, it's not a case of sets and reps, it's a case of quality. And then I think a big thing is having some KPIs or key performance indicators in there as well. So when you do a set, you recheck your key performance indicator, and if that's staying the same, that's great. Maybe it might even improve. But if it starts to go down, such as a knee to wall or a toe touch, or whatever your key performance indicator is, once that starts to go down, then I'm thinking, okay, the nervous system's not liking this, let's back off a little bit. Okay, we've probably done a little bit too much. So I'm very much correlating all the time in exercise with a key performance indicator. So as I said, that always guides everything we do. We're always trying to get to the next level as quickly but as safely as possible. So I would kind of use both of those rather than just a sets and reps type range. There was a running joke with Munster Rugby that I used to only ever use dry needling on a Monday morning when I was hungover. But look, all jokes aside, I think it's okay. I think if you can justify why you're using, I'm fine with it, but I just really encourage you to clinically reason all the time why you're doing it. So don't just dry needle a glutamide or a QL or something like that for everybody that has back pain. Again, it's kind of be a sniper, so to speak, with a dry, so be a sniper with a dry needle rather than a bazooka. Okay, so again, I see a lot of people just throwing dry needles in all over the place, you know, one shot to get what you want. That's what I would encourage you to do with that. But as I said, use it an odd time. I found sometimes I get decent results like with a VL for knee pain or something like that. If someone's really high tone, might throw a few dry needles in there at odd time, but that's usually in camp, if I'm being honest, with a team, and I've got a bit of in private practice. I very rarely use it, to be honest with you. None of the therapists in our clinic use it, but again, you know, just clinically reason, and I'm sure you'll be absolutely spot on. Cheers, lad. Positive vibes to you too. Hope everyone's staying safe. I hope you're protecting your mindset, and I hope to God that you're getting a lot of work done at the moment. Okay, use this as an opportunity to get your marketing done, to sort your website, to sort your structure, to sort your clinical reason out, to sort your step-by-step system out. Use this time wisely. You will never get this time back again. So make the most of it, and you know, first and foremost, stay safe. I hope you and your family are safe.